This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
I know I've been there, Jimmy, you've been there, and you've probably been there too. You don't feel well, you go to the doctor, and you leave with a prescription that you hope will have you back to your normal self in no time.
And in many cases, sure enough, you are back to feeling like a human again. In fact, antibiotic use is so common, according to the Centers for Disease Control and Prevention, 4 out of 5 Americans are prescribed them every year. Let's take a look at some of the most commonly prescribed antibiotics according to the University of Washington. First, penicillin, amoxicillin, cephalosporins, azithromycin, also known by its brand name of Z-Pak. There's also clarithromycin, also known as the name Biaxin, ciprofloxacin, also called Cipro, tetracycline, and doxycycline. Millions of prescriptions for these drugs are written every year, and they're very effective for a lot of people. But what happens when the medicine you're prescribed does more harm than good?
Well, some people who have been prescribed Levaquin say it happened to them. The antibiotic is used to treat things like bronchitis, pneumonia, and skin infections. But these patients say Levaquin has changed their lives, and they're not happy about it. Andrea Ciani doesn't get around her home like she used to, not since she was treated for pneumonia last winter. She was prescribed the generic version of Levaquin, a powerful antibiotic.
It was a prescription for 10 days. On the 9th day, my arms went numb. And that night I woke up around midnight with, it felt like flames were coming out of my elbows.
Just days before, she was skiing with friends. Andrea says this has changed her life. The limitations are extreme.
My life has really become extremely small. You know, I can't go out and do errands. I can't, go food shopping.
Thousands of patients have reported similar reactions to Levaquin, one of a powerful family of antibiotics known as fluoroquinolones. In one case in Boston's federal court, a man sued, saying he suffered severe and debilitating tendon injuries. Levaquin has a black box warning from the Food and Drug Administration for increased risk of tendon ruptures, muscle weakness, and impacts on the central nervous system. A black box warning is the most severe safety advisory before a drug is pulled from the market altogether. So just how powerful is the drug? 2 of the prescribed uses are anthrax and the plague.
It is powerful.
Dr. Charles Bennett is one of the nation's leading watchdogs for prescription drugs. He says the big problem with fluoroquinolones is inappropriate use.
We're talking about going to a physician's office, having a little bit of sniffle, walking out with an antibiotic, and then shortly thereafter having these kind of problems.
Dr. Bennett has filed 2 citizens' petitions with the FDA seeking to expand the black box warning to include mitochondrial toxicity, meaning damage can occur within a patient's cells and possibly manifest years later as Parkinson's, Alzheimer's, or ALS.
Potentially a genetic predisposition to be a poor metabolizer of the drug. So it's not what you take it for. It's who you are.
The second petition wants to highlight the potential for serious psychiatric events.
This is another one for if I'm depressed.
Carolyn Egan was given Levaquin to treat a sinus infection. 8 years have passed, and the former daycare provider says she's never been the same.
One day I can be okay on focus, and another day I can't even talk to anybody because they're not making sense. It sounds like they're not speaking English.
It's a real concern for us.
Dr. Ludvikas Jagminas says physicians walk a fine line today because so many antibiotics don't work like they once did.
Unfortunately, we don't have a whole bunch of other potential drugs we can use. Obviously, if we can use a different drug, we certainly would.
Carolyn regrets she didn't get any warning.
You don't be normal and then 3 days after taking a medication, and it's the only medication I was on, you can't walk.
In a statement, the makers of Levaquin say the drug has been used for more than 20 years to treat infections, including those that might be serious or life-threatening. When used according to the product labeling, Levaquin has been proven to be a safe and effective medication. The FDA says it is reviewing the citizen petitions. A spokesman says the agency considers drug labels living documents so they can be updated as new safety information becomes available.
Now, no matter what medicine it is, it's important to arm yourself with knowledge when it comes to antibiotics.
You don't want to just take something because someone tells you to. You want to be sure that it's actually necessary. So joining us today with some helpful information is clinical pharmacist Mike Miller with Peninsula Regional Medical Center. Thanks for joining us this afternoon. First of all, you just heard the story about Levaquin. What's your take on it?
Well, we've used Levaquin for 20 years. We've had millions of prescriptions written. The more you write for a drug, the more chance there is for serious adverse effects like this occurring. The doctor mentioned that some of these are pretty rare, the mitochondrial disease. It's something that may occur the more we use it, but we're kind of forced to use it because of overuse of other antibiotics and resistance building up, so we still need to have some drugs to treat infections.
I'm glad you said that, because we just mentioned that 4 out of 5 Americans are prescribed antibiotics. Is there a fear that we're over-prescribing antibiotics?
There's a big fear. The CDC says 30 to 60% of antibiotics in the hospital are probably unnecessary. There's another study out that shows that 65% of the time if somebody asks for an antibiotic, they'll get an antibiotic, but if they don't ask, it only happens 12% of the time.
Wow.
So there are ailments that really don't need an antibiotic, aren't there?
There are many. The common cold, most of these are viral infections, the common cold, the flu, ear infections, sore throats, many of them are viral in nature, and antibiotics don't work against those.
So we just sometimes need to
watch and wait.
Watch and wait.
Sometimes. It depends on the situation, depends on, with ear infections, the age of the child. Sometimes you don't want to wait, but in general, you can often wait before you treat.
Okay.
So what about ailments that you do want to take an antibiotic for?
Oh, certainly. Pneumonia, skin infections. You're going to want to take it for whooping cough, strep throat. You do have a sore throat. About 10% of those are caused by bacteria. They can do a rapid test for that, though, to see if it's a bacteria versus maybe a viral infection. Urinary tract infections, definitely.
Okay. So we're just human. Sometimes we can be misprescribed an antibiotic. What do we do then? Well,
it may not be a matter of misprescribed. I mentioned the resistance problems out there. You may get an antibiotic, but due to overuse over the last 40, 50 years of antibiotics, it may be resistant. So, you know, you want to wait no more than 48 hours. If you're not better in 48 hours, you're going to want to contact your doctor and perhaps have a different antibiotic prescribed.
So are we creating superbugs? I hear this all the time.
We are. It happens. There was an outbreak recently of what's called CRE out in California due to improper cleaning of equipment.
Right.
It's a highly resistant organism. You do see it throughout the country. It's started mainly in the Northeast. We've seen cases here on Delmarva, but it can be very difficult to treat. We're running out of antibiotics for some of these organisms.
So why are they being prescribed so much?
Well, sometimes, the doctors are very busy, and sometimes it's just easier to write a prescription. Sometimes there is a fear that if they don't prescribe a medication and the patient gets worse, there could be a lawsuit. So there's a little bit of defensive medicine out there. It's a balancing act.
It is a balancing act, and they're balancing between viruses and bacteria, right?
Sure. If you're not sure and they don't want to do any harm, so sometimes it is easier just to write the prescription.
Okay, so what would you tell someone? I mean, we need antibiotics.
Right.
What would you tell somebody before they actually start an antibiotic?
Well, the big thing is have the discussion with your doctor, pharmacist, make sure that they really feel it's necessary. Talk about side effects. A lot of these, the piece before, the side effects can occur.
Right.
Let your doctor know as soon as it occurs. Let your pharmacist know. Get it into the system so it can be reported to the FDA even if it's a new adverse reaction. Speak up about other medications. A lot of these have drug interactions. They can increase the levels of the drug, more chance of a side effect. It can interact so that the drug doesn't even work. It all depends on the nature of the interaction. And if you're not better in 48 hours, call your doctor.
48 hours is important.
48 hours is important.
All right.
Mike Miller,
Dr.
thank you so
Miller.
much.
Nice to be here. Thank you very much.
And to read more from PRMC about antibiotic safety, go to WBOC.com and click on our picture at the top of the page.
Okay, so from safety regarding your health to safety in your community. Up next, we're going to get an inside look at a day in the life of a canine officer. You're going to learn how Dog Diablo sniffs out crime right here on Delmarva, plus how this special officer canine bond helps in more ways than one.
And you can help too. After the break, we learn about the late Deputy First Class John Norman Brune, how you can help his legacy live on. Delmarva Life, we'll be right back.